You think your old masturbation habits are harmless, but after 60, they can quietly damage your body in ways you'll only notice when it's too late. After more than 5 years of working with men in their 60s, 70s, and beyond, I've seen how a few simple changes can protect your health, restore your confidence, and bring back pleasure you thought was gone for good, and I'm going to show you exactly how. If you've ever faced this, drop the number one in the comments, so I know you're here and ready for real answers. Feel free to share your age or your year of birth and where you're watching from. We value knowing our viewers so we can keep bringing you meaningful insights and practical tools for your well-being every day. And don't forget to hit like and subscribe so you never miss the kind of content that helps you live healthier, stronger, and more confident one day at a time. Think back to how well you used to know your own body, how predictable it was, how quickly it would respond, how easy it was to get from the first spark to full satisfaction. Now ask yourself, why doesn't it work the same way anymore? For many men over 60, the change feels subtle. At first, a little more time needed a little less intensity, but over the years, that gap grows. You may find yourself wondering if something is wrong, or worse, if you're losing it. But here's the truth, you're not broken. What you're feeling is biology, and once you understand it, you can work with it instead of against it. The first shift happens deep in your hormonal system. Testosterone, the hormone that fuels your sex, drive your energy, your mood, and the quality of your orgasms, starts declining as early as your late 30s or early 40s, dropping by about 1 to 2% each year. By the time you're past 60, those small yearly dips add up. It doesn't mean desire disappears, but it often changes its rhythm. Instead of spontaneous urges throughout the day, arousal may need a bit more mental and physical stimulation to get started. Research has even shown that lower testosterone levels reduce the frequency of spontaneous arousal, the kind that used to catch you off guard when you were younger. This isn't failure, it's simply the way your internal chemistry is shifting over time. The second big change is in your blood vessels. Erections are, at their core, a vascular event, blood rushing in and being trapped in the right places. But as we age, the walls of our blood vessels lose some of their elasticity. Tiny plaques can form, narrowing the pathway. Blood flow slows down and takes longer to build up. That's why you might notice your erections are slower to appear, or they fade more easily if you lose focus. It's not just about sexual health. These same vascular changes are also linked to heart health. In fact, difficulty maintaining an erection can sometimes be one of the earliest warning signs of cardiovascular issues. Then there's your nervous system. The nerve endings in the penis, especially around the foreskin and shaft, gradually lose density with age. This doesn't mean you can't feel pleasure. It means the signal takes a little longer to reach the brain, and sometimes the brain processes it with a little less urgency. What used to be an instant surge of sensation might now feel muted or delayed. That's why old patterns, fast, forceful, goal-driven, can leave you feeling less satisfied. The wiring is still there, but the transmission speed has changed, and you need to adapt how you use it. And finally, your skin and soft tissue tell their own story. The skin on the penis becomes thinner, produces less natural lubrication, and loses some of its natural stretch. Combine that with reduced blood flow, and it's easier to cause irritation or tiny injuries from friction, especially if you skip lubrication. It's a bit like driving a classic car. The paint still shines, the engine still runs, but the parts need more careful handling to keep them in top shape. If all of this sounds discouraging, here's where the perspective shifts. A study published in the Journal of Sexual Medicine found that men over 60 are about 2.3 times more likely to experience reduced genital sensitivity than men in their 40s and 50s. That sounds like bad news until you remember this reduced sensitivity is not the same as lost function. Your body hasn't given up on you. It's entering a different phase, one that can still deliver profound satisfaction if you work with the changes instead of fighting them. That's exactly what we're going to explore next, how the habits you've built over a lifetime might actually be holding you back now, and what to do instead. Now that you understand how your body changes after 60, we need to talk about something most men never realize until the damage is already done. The way you've been touching yourself for decades might be working against you now. It's like driving a classic car at full speed down a rough road. You might not notice the wear right away, but the engine is taking a beating. And in this case, the engine is your circulation, your nerve sensitivity, and your confidence. There are 5 habits I see over and over again in men over 60. They seem harmless, they even feel familiar, but they're silently wearing your system down. And the sooner you spot them, the sooner you can replace them with habits that actually work for your body now. The first mistake is gripping too hard. You might think a firm hold makes things more intense, but after 60, the skin is thinner, the blood vessels are more fragile, and the nerve endings are less resilient. That strong grip can rupture tiny capillaries, desensitize the nerves over time, and lead to something known as death grip syndrome, where you can only respond to that same intense pressure and nothing else feels good. Studies measuring hand strength show that more than 3 to 4 kilograms of force can create microscopic tears in erectile tissue. You may not feel it immediately, but over the years, it can change the way your body responds. The fix is simple but powerful. Ease your grip by 30 to 40%. Focus on the quality of sensation instead of the quantity of pressure, and let your touch be something your body can actually process and enjoy. The second mistake is starting too fast. I understand it feels natural to jump in, especially if you're in the mood and want to get things going. But remember what we discussed earlier, your nervous system processes sensation more slowly now. When you go too fast from the start, your brain can't fully register the signals. The result is a kind of sensory static, like trying to listen to music on a radio that's slightly out of tune. You hear something, but it's distorted and it never quite hits right. Instead, start slow. Give your body a chance to catch up. Build gradually, paying attention to when sensations deepen instead of just getting faster. Often that slower build will create a more powerful and satisfying climax, if you choose to go there, than any rapid start could. The third mistake is skipping lubrication. Too many men think lube is only for partnered sex, or worse, that it's somehow unmanly to use it alone. That mindset is costing you pleasure and possibly causing harm. As testosterone declines, your skin produces less natural moisture, and combined with thinner tissue, that means more friction. Friction can lead to irritation, redness, or micro-injuries that make the next session uncomfortable. Research shows that 60% of older men never use lubrication during solo activity, and those who don't have double the rate of penile skin irritation compared to those who do. The solution is straightforward. Use a gentle, unscented, water-based lubricant from the very beginning, not halfway through. Coat not just the shaft, but the base and surrounding areas, so everything moves smoothly and comfortably. The fourth mistake is forcing climax. For much of your life, orgasm was the definition of success, so it's no wonder many men push for it every time. But after 60, forcing the finish can backfire. When you put your body under that kind of pressure, you activate stress hormones like adrenaline and cortisol. These hormones are the exact opposite of what your body needs. For an erection, they constrict blood vessels and reduce nitric oxide, which is essential for keeping you hard. The harder you push, the more your body resists. The alternative, try edging, bringing yourself close, then easing off, riding waves of arousal instead of sprinting to the end. You might be surprised to find that the journey becomes more satisfying than the finish line. And finally, the fifth mistake, ignoring your body's signals. After decades of doing things the same way, it's easy to go into autopilot. But at this stage of life, autopilot can lead you straight into trouble. If you feel discomfort, numbness, or even boredom and you keep going, you train your brain to associate self-touch with negative sensations. Over time, this can lower your desire, make it harder to get aroused, and even create performance issues during partnered sex. The fix is to stay present. If something feels off, change your position, adjust your technique, or stop and try again later. Listen to your body the way you would listen to a partner. It's telling you what it needs. And when you respond, the experience becomes better for both your body and your mind. These 5 mistakes aren't about judgment, they're about awareness. Once you see them, you can start making small shifts that not only protect your sexual health, but actually enhance it. And in the next part, I'm going to walk you through exactly what those shifts look like, step by step, so you can create a routine that works with your body's changes instead of against them. This is where pleasure after 60 stops being a gamble and starts becoming a skill you can master. Now that you know what's been quietly working against you, let's talk about what will work for you starting right now. Your body at this stage is like a finely crafted vintage instrument. It can still play beautiful music, but it responds best when you handle it with precision, patience, and a sense of respect for its unique character. Changing the way you touch yourself isn't about giving up what you've always enjoyed, it's about upgrading the experience so you get more pleasure, better performance, and long-term health without paying a hidden price later. The first step is preparing your space. You might think environment doesn't matter when you're alone, but it matters more than you realize. Your parasympathetic nervous system, the rest and receive pleasure mode, only switches on fully when you feel safe and undisturbed. That's why the right setup can mean the difference between frustration and deep satisfaction. Find a quiet spot where you won't be interrupted for at least 15 to 20 minutes. Keep the lighting warm, not harsh, something like a soft amber desk lamp instead of overhead fluorescence. Make sure the room is comfortably warm and free from sudden noises that pull you out of the moment. These small changes signal to your brain you're safe, you can relax, and pleasure is allowed to happen. Once your space is ready, don't rush in, breathe first. Deep, steady breathing primes your body in ways most men never take advantage of. 5 to 7 slow breaths can lower your heart rate, relax tense muscles, and increase blood flow to your pelvic region before you even start touching yourself. Inhale through your nose, hold for a count of 2, then exhale slowly through your mouth as if you're letting go of every last ounce of tension. This simple ritual shifts your brain out of alert mode and into a receptive sensual state. So when you do begin, your body is already ahead of the game. From there, make lubrication your ally. After 60, your skin produces less natural oil, your tissue is thinner, and the risk of friction damage is higher. A good lubricant isn't an optional extra, it's essential for protecting your skin, keeping nerve endings sensitive and ensuring every stroke feels better, not harsher. Choose a water-based, unscented formula and apply it generously, not just on the shaft, but over the base and scrotum too, because pleasure doesn't only come from one spot. If you want to go a step further, pick one with vegetable glycerin to lock in moisture and keep things smooth for longer without reapplying. When you finally start, resist the urge to go straight for the most sensitive area. Begin by touching places that aren't as reactive: the inner thighs, the scrotum, the lower abdomen. This indirect stimulation allows blood to slowly fill the erectile tissue while your nerves warm up to the sensation. It's like letting an engine idle. Before hitting the gas, you build power, steadily avoiding the overload that can cut pleasure short. As arousal builds, pay attention to your rhythm. In the first 60 to 90 seconds, keep your pace slow and consistent. Let your mind and body sync up so each sensation fully registers. Only increase speed or intensity when you feel the pleasure deepen naturally. Rapid, constant changes in pace can confuse the nervous system at this age, causing those frustrating moments when sensation just drops away. By holding a steady rhythm early on, you create a foundation that carries you further. Switching your position can also transform the experience. Certain angles put less pressure on the pudendal nerve, the one that carries sensation from your genitals to your brain, and promote better circulation. Try lying on your side with a pillow under your hip or reclining with your back supported. These small adjustments reduce muscle fatigue, keep blood flowing, and can even enhance the strength of your erection. Finally, learn to pause and ride the wave. What I call wave arousal is the art of letting pleasure crest and then easing off before climax. When you feel the sensation peak, slow down or stop for 10 to 15 seconds, then start again. You'll often find that the second or third wave is stronger than the first, and you avoid the sudden drop in desire that can follow a forced orgasm. If you want to take this to the next level, practice edging. This means deliberately approaching the point of no return, pulling back, and repeating that cycle 2 or 3 times before you finish, or not finishing at all if you choose. For men over 60, edging can be a game changer. It improves control over ejaculation, boosts blood flow, and actually increases sensitivity over time. 2 or 3 sessions a week is enough to train your body without overdoing it. When you combine these steps, you're not just avoiding harm, you're turning self-pleasure into a skill you can keep improving. And in the next section, we're going to talk about how these changes can ripple out beyond your solo routine into your energy, your relationships, and your overall sense of vitality. Because when your body feels good, everything else starts to rise with it. But there's one more piece of this conversation we can't avoid, because while some changes after 60 are simply part of the natural rhythm of aging, Others are your body's way of sending up a flare warning you that something deeper needs attention. Think of it like the oil light in your car. You don't wait for the engine to seize before you act. When the light comes on, you respond because ignoring it can turn a minor fix into a major breakdown. In the same way, there are 4 specific signs in your sexual health that you should treat as non-negotiable triggers to see your doctor. The first is persistent pain or burning even when you've been careful with lubrication and technique. This isn't just irritation from a rough session. It can point to inflammation of the skin, a mild infection, or urethritis, the irritation of the urinary tract itself. Left untreated, these can spread, cause scarring in sensitive tissue, and create lasting changes in sensation that no amount of technique can undo. Early treatment is simple. Late treatment is far more complicated. The second is sudden numbness or a noticeable loss of sensation in any part of the penis or surrounding area. This can be a sign of nerve compression injury to the pudendal nerve or even an early complication of diabetes. Nerve damage can progress quietly without pain, but the longer it goes unaddressed, the harder it becomes to reverse. The advantage of catching it early is that many causes can be treated, restoring sensitivity before it's gone for good. The third is the inability to achieve an erection, even in a calm, private, stress-free setting. We all have off days, but if this becomes consistent, it may be pointing toward cardiovascular disease, high blood pressure, or hormonal imbalance. Remember, your penis is a barometer for your vascular system. The same blood vessels that feed an erection feed your heart and brain. A problem here often means a problem there. And getting that checked could be the difference between catching a health issue early or missing the warning until it's too late. The fourth is more subtle, but no less important, a sense of emotional disconnection or rising anxiety when you touch yourself. Physical pleasure is deeply tied to emotional state, and if you notice dread replacing desire or numbness replacing joy, it can be the shadow of depression, anxiety, or a shift in your hormonal balance. This is not a weakness, it's chemistry, and it's treatable when addressed openly. Sometimes the solution is a combination of medical evaluation and talking with a therapist trained in sexual health. Here's the sobering truth: 1 in 3 men ignore these early vascular or neurological signs only to discover later that they were the first indicators of serious heart disease. That's why I'm telling you, don't wait for things to get worse. Annual checkups are not just about cholesterol and blood pressure. They're about protecting your quality of life, your confidence, and the private moments that make you feel fully alive. Listen to your body's warning lights. Acting early doesn't just prevent damage, it keeps you in the driver's seat of your own pleasure and health for years to come. Your body may not be broken yet, but it is changing. And if you adapt your habits to match those changes, you can protect your health, keep pleasure alive, and stay confident for years to come. Every smart adjustment you make now is an investment in your future self. How did today's content resonate with you? Did anything make you reflect more on how you care for your health? Share your age, your year of birth, and where you're watching from. We love knowing our viewers. And if you found this message helpful, like and subscribe so you never miss the content that helps you live healthier, longer, one day at a time.